Hello everyone, it's Dr. Samantha Benjamin Allen, board certified in physical medicine and rehabilitation, here to talk to you today about systemic lupus erythematosus, commonly known as lupus or SLE. This is an autoimmune inflammatory disease which is considered chronic and can affect any organ system. Most common symptoms at presentation or when people notice something isn't right is arthralgia or joint pain, fever, rash, excessive fatigue that doesn't really add up to the amount of energy you're expending. And like I said, it can affect any organ system, so it can show up differently at different times. And people who suffer with lupus can go through very debilitating circumstances, especially if it affects multiple organ systems. Now, when it comes to lupus, what can we do about it? Because it's autoimmune means it's attacking cells that are your normal cells as if they are infected foreign bodies or a threat to your system. So one thing I would start with is making sure you have a balanced diet, because there are inflammatory foods that can make lupus worse. And this takes a lot of time to kind of go through your diet and see where modifications can be made. But certainly worth looking up inflammatory foods or foods that can flare up lupus. And people who have lupus can have photosensitivity, meaning sensitivity to light, and high intensity sunlight can flare up lupus. So you want to make sure you're getting enough vitamin D, for example, because we get vitamin D from the sunlight. But if you are avoiding intense sun exposure to try to prevent flare-ups, you want to make sure you're getting enough vitamin D. And low vitamin D also can cause a lot of fatigue and low energy. Now, it can affect your lungs. You could develop interstitial lung disease. It can cause a lot of issues in your hematological system, meaning your blood. People can get leukopenia or anemia. It can affect your kidneys. It can affect really any organ system. But those are some of the common ones though. And in terms of medications, there are multiple options, and everything does not work for everyone. So it's important that if you are taking medications for lupus or being recommended to, that you ask your physician what the side effects are of those medications, because they do come with side effects, and you want to make sure that if you're taking them, you're looking out for any changes and you're aware of what could happen. Steroids are used short-term for flare-ups often, but it's not recommended to take them long-term because they can cause bone mineral loss or bone density decrease, and we want to avoid that if we can. So just know that. And also there are biologics or disease modifying agents that are used, antimalarials, anti-inflammatory medications, and certainly exercise is major. So it's important that you exercise on a regular routine. I say 4 to 5 days a week for 45 minutes, at least, just to maintain your mobility and your energy, because exercise actually increases our endorphins, which are a natural hormone that we produce when we exercise, and it helps us to have increased mood or improved mood and increased energy levels, and it's good for your body. Make sure you stay hydrated. You want to drink enough water, and I will leave it at that so this isn't too long. But if you are a person who has suffered debility from lupus or any chronic disease or prolonged hospitalization that has left you with a significant decline in function compared to how you were functioning before, I invite you to work with Freedom Wellness Physiatry, where we are passionate about seeing others thrive despite their circumstance or disability, and want you to achieve increased mobility, function, independence, and quality of life. So if that sounds like you, I invite you to book a consult at freedomwellnessphysiatry.com, and physiatry is spelled P-H-Y-S-I-A-T-R-Y, and we make house calls, so we will come to you and work with you, and I look forward to partnering with you in your journey to living better. Have a great day. Till next time. Bye-bye.